Hey, it's Jessica DaMassa with WTF Health. Joining me right now, I have Dr. Rasu Shrestha. He is the Chief Strategy Officer for Atrium Health. Wow, it is weird to introduce you as that.
Yeah.
No, congratulations on that. I'm typically moving on from UPMC, but that's like really exciting news for you. Interested to hear what it is that you are going to be taking on this year in your new role. I mean, you're in this cool period right now where you're transitioning. And so it seems like you've been kind of just, not stepping back, but looking at things a little bit differently. We've had some offline conversations here. And so we were talking just now about, the fact that we're here at JP Health. It's in San Francisco. And, just even walking down the street here, you see a lot of different socioeconomic classes. There's homeless issue here in the city. You're walking around JP Healthcare with a lot of people who are, pretty well off, doing very well. The healthcare industry is here. How does this start to, impact your thinking about what's coming next in healthcare, the transformation of health, and how we can start to address, helping make people healthy, in that whole scope of social determinants of health, and things that are helping, kind of keeping people back from really becoming their best selves or becoming the most healthy versions of themselves?
Yeah, so it's really interesting, even as I go through my transition and going from one stellar institution, that's UPMC, where I've spent 11 years of my career and my life and where I've called home and I'm so passionate about, to now this newer organization that, for me at least, Atrium Health, which is fantastic. Really, the impact that Atrium's already had across the communities is tremendous, but the potential for a health system like Atrium Health to really take things to the very next level and focus in on some of the things that are so basic for us, and other things as well. But to your earlier question about social determinants and the impact that we need to have at the community level, that's one of many things that I'm really, really excited about. So one of the things that I had the privilege of participating in today was just a closed discussion amongst entrepreneurs. These are presidents of health plans. These are investors in the topic of social determinants of healthcare. And I'm walking towards this meeting, right, here in San Francisco. And I kid you not, I'm navigating the streets, walking around individuals, homeless individuals who are on the streets,
right,
chucking their carts away, dealing with mental issues. This is real.
It is.
This issue that we have in healthcare today, this disparity, this issue of addressing unmet needs amongst the most needy populations that we have, and I'm not just talking about the homeless population, I'm talking about communities in general.
Yeah.
This is absolutely real. One of the challenges, I think, of social determinants too is sort of the nomenclature.
Oh my God, because it dehumanizes that so badly, doesn't it?
It does. And I think, if we look at social determinants of healthcare and there's all the opportunities that exist around this, really as, how do we really address some of the barriers to health versus just social determinants of healthcare, then barriers to health is something that we can really get our minds around, and we can really then figure out the specifics of how we measure, how we incentivize, and how we really motivate ourselves to support this financially too. Because it makes sense for us to look at, all right, you've got this patient who needs to come in for dialysis, right? But can't afford the transportation to come in. Well, as a health system, it makes sense for us to fill that void and say, all right, we got to do this. We got to address that barrier to health.
It's the health system, because I agree, and everything you're saying, I think most people would agree with. Because I genuinely believe here in healthcare, everybody wants to do well. They do want to improve outcomes. Is the system though, the really pragmatic data parts of the system, is it built to identify a situation like that? I'm looking at a patient's record and they keep no-showing over and over again. Is there a way to even know the problem is not because they don't want to come, not because they don't care about their health, not because they don't want their dialysis, but because of the fact they can't get a ride? Are we able to find that stuff out?
Not very well in the environment that we have today, right? Because what we have, even in 2019 right now, if you look at all of the different things that we've done in the last decade, 2 decades, 3 decades in embracing digital, we have these, what I call these data blind spots that we just are not being able to get into, right? So
give me an example.
So the fact that Mrs. Jones doesn't show up for an appointment is a data blind spot. We don't know why she shouldn't show up for an appointment, right? There could be a numerous, set of reasons why you should not show up for an appointment. But how do we get at those specific data blind spots and address the barriers to health in those data blind spots? Because I think that's really important. At the end of the day, we all know, and we've talked about this, how healthcare is shifting from the bricks and mortar hospitals to where people eat, work, live, and play.
Yep.
And it's not just about the patients, it's really about the consumers. I look at this as more of a person-centric approach to care.
Okay.
When you look at this from a person-centric approach to care and then overlay that with what I mentioned earlier, as the barriers to health, then you're really then being able to hone in on the specific data elements that we've not had access to thus far, that we need to be really opening our eyes towards. We need to move away from these data blind spots to leveraging the power of data and insights to have these populations, these reasons for missed exams, why they could not come in, these barriers light up in our dashboards and show us the specifics of how we can then hone in on those specific challenges, right? Risk stratify the specifics of those opportunities and then go after them in a very targeted and efficient manner.
I want to ask you, recently, this reminds me of this in a way. So I read an article about climate change and about how, you have all these green companies and they're trying to do things, but it was like things were not getting done in a way at scale because the incentives were not aligned to it. And as soon as you change the incentives as far as around climate change and whatever, and figure out who pays and who's responsible, all of a sudden you start to see some of these, initiatives that seem like goodwill initiatives start to get funding and start to actually become commonplace. I'm almost wondering, on the parallel in healthcare, some of these things, who's responsible for that? Is that the hospital system? Is it the health insurance company? Is it the patient themselves? Who is responsible for finding those data blind spots and then funding the things that need to be put in place to make sure that we can see them? What are your thoughts on that?
So here's the problem in healthcare, right? The problem in healthcare today is the fact that we're extremely siloed and tunnel vision in the way that we're looking at the specifics of what we think we're incentivized to do, right? We're really siloed in that. The reality is that, as we started talking off earlier, there's nothing more real, there's nothing more human than this pursuit of health and care that we're all talking about, right? But when you look at that, it's not just the specifics of how do you look at the challenges of an emergency department or an inpatient department or the specifics of, at-home care. It really is a continuum approach. It also is about looking at, the specifics of what it means to be in an environment where you're not just trying to get better, but you remain well, and you have the ability to live the fullest life that is most meaningful for that individual, right? This definition of personalized medicine goes down to the specifics of even your desires and your aspirations, not just the specifics of your genome and your phenotypic type, right? So I think it's really important for us to look at that fuller context and have that then drive the specifics of how you incentivize the specifics of better care. Because when you then look at that, then you start seeing the models shift from where it's not just hospital systems trying to incentivize the specifics of what matters to them, but really the health and the healthcare systems coming together in this ecosystem approach.
Do you think, how do we do that? Because strategically, spot on right there. But you're a health system guy. We've all interacted. There's the department head of this who's got his little budget that he wants to protect and doesn't want to work with the department head of that because that guy's got his little budget and he's trying to protect that. So it's kind of one of those, it's like everybody's kind of got to give up to get. How do we start to think that way, especially in healthcare where things are, since the beginning have been just so fragmented and so siloed. Health plans versus health systems and doctors versus, there's just so much stratification. So how do we all give up to get? What would your advice be?
So there are multiple different things that we need to be doing right. And there are some of these things that are moving in the right direction. For example, we have these technology solutions that are out there. But I think what we need is a massive infusion of technology innovation so we can have access to the right data points as we were talking about earlier. The other key element here is really looking at more of a process innovation as well, right? And by that, what I mean is that healthcare up to today has really been very paternalistic, right? It's more of a one-on-one interaction, it's episodic, and we need to shift from that to more of a participatory, collaborative, sort of an ecosystem approach. And if we're able to have more of a business model, innovative stance towards that, really look at these business models that really propagate and foster that type of an interaction, then we're moving towards the right direction.
Okay. Technology innovation, process innovation, business model innovation.
Right.
Okay.
Absolutely.
Oh, right.
Yeah.
Hold on a second. You know where I'm going, right?
Yeah.
All right. I'm going right there. I'm going right to those consumer tech companies because everybody's looking at that. So this is the thing. You got those three things, and I think you beautifully articulated. What comes first, right? We're watching the industry get an influx of those consumer tech companies. And some of this, I mean, business model innovation companies. I count Amazon as that. They completely upended it. I mean, multiple industries with their ability to completely redesign supply chains and business models around the way things are done. Do you think that that's the infusion here, or do they not have enough knowledge of the process today to participate on that process innovation piece, where it's going to hold them back? I mean, what do you think? So when we're looking at this, almost like it's like watching the tsunami coming way over there. I mean, what do you think?
So I'm actually really excited by the fact that we've got these big tech giants like Amazon and Microsoft and Google taking such a massive interest in quote-unquote disrupting healthcare, right? I don't like the word disruption, but having said that, that's the vision, that's the stance that they're taking, right? So what's really interesting as you observe this happen and unfold in front of our very eyes is the fact that Amazon is approaching this in a very different way from how Microsoft is approaching this, and in a very different way how Google is approaching this. So it's encouraging to see that there are these different types of efforts. So they're not all doing the same things,
thing,
right?
Not even close.
No, but I think it's really important for us to understand the fact that part of what's going on here from an Amazon perspective example is their desire, their appetite to not just challenge the status quo, but to say, hey, look, how do we truly upend the business model of delivering healthcare in ways that other industries have really managed to figure this out? So I think that's actually a really good thing. I think it's really encouraging for us as those who've been in healthcare for the longest times to really look at this and say, all right, this is an opportunity. This is an opportunity for us to sit down with the folks at Amazon that are really sort of thinking through these processes and looking at newer ecosystems, pushing the boundaries of what we had defined as the edges, and saying they're not the edges, they're the beginning. They're the niduses of newer growth areas, right? That's important for us to sit down with the technology gurus of Google and Google Cloud, the aficionados of Microsoft that are really pushing the edges of artificial intelligence and cloud, and say, all right, look, here are the pain points, here are the challenges that exist in healthcare today. And I've talked in the past about how the future of healthcare is going to be built on the shoulders of the strongest of partnerships. And in these, giant tech companies, our potentials for us, if we're able to partner right, if we're able to really look at this strategically and put our heads as well as our capacities and our hearts together, we would be able to really get healthcare right.
I know I guess this depends who you talk to. Are you seeing that people are adopting the similar mindset that you have, where it is the future of healthcare is going to be built on these partnerships? Or do you think that it's like people are looking at this as an adversarial relationship with some of these tech companies? I keep asking, should healthcare be afraid? Or should they be, cautiously optimistic? What would you say to that?
I think it's really important to continue to make sure that we're challenging ourselves. If we're not challenging ourselves, if we're not actually growing in the direction that we need to be growing, then we're going backwards. We're going in the negative. And what these tech giants are doing is they're giving us an opportunity to really question ourselves, even in terms of what drives and motivates us, right? And I think for us, it's important to make sure that before we get disrupted, we disrupt ourselves. Right. So it's not a question of, these tech giants are coming in to disrupt us and let's, fear them. No, we got to look at where we are and disrupt ourselves before we get disrupted. And that's the reality of the mindset that we need to have in really looking at the future of healthcare.
How do we adopt that mindset?
Well, we adopt that mindset by first really looking at these opportunities that are out there and saying, all right, how do we overlay those to the challenges that we know exist in the delivery of healthcare? We're the ones who are feeling the pinches, right? We're the ones who are on the ground. And that's what excites me most, is to be able to work with organizations, an organization like Atrium Health, where we're able to really look at how impact is being made across communities at existing health systems as we've defined it today, but as newer care delivery models come to be, we're the ones who know where those pain points are. And we have the ability then to match that with the specifics of these advancements that startup companies and larger tech giants are making, how disruption, quote unquote, is happening even outside of the healthcare industry and bringing some of those mindsets to foray here. And then, and we've talked about this before, but specifically looking at not just how technology could impact the delivery of care and how business models, as we talked about, could impact the delivery of care and process. But I'll throw one more thing.
Oh my God, do it.
Policy.
Right? I was just going to say.
So how do we make sure that we're able to...
I was going to ask you that because, I mean, the policy environment, I mean, you can't take the social determinants conversation, the technology conversation, and then have this conversation about healthcare without talking about health policy.
Absolutely. And it's so important for us to get that right, that intersection between public, private, and policy. The specifics of how we look at policy, not just as a thing that we react to.
Oh my God. Well, I mean, but the last couple years, I mean, the last 6 years, wouldn't you say the last 6 years?
Absolutely.
Healthcare has been through the ringer when it's come to health policy.
So the last decade or more really has been that. And HIPAA has been about that, meaningful use has been about that. It's all been really, really reactive. And the opportunity upon us right now, and I know that the folks, the 3-letter acronyms and DC and beyond, they're ready for this. They want this.
Totally.
They want for us to be participatory in the co-creation and the co-design of these policies that will really push healthcare to the next level. Enough with the reactiveness. We have to be proactive about this, and we have to make sure that we work together to really address some of the specific challenges of how we not just reduce but obliterate these barriers to the delivery of better health.
Okay, it seems like this past year, 2018, there was a lot more collaboration, it seemed like, from certain government agencies about trying to help participate in defining standards, particularly data standards, or providing different pathways, like the FDA coming out with different faster options for FDA approval for digital solutions or digital therapies. Yeah, pre-cert, all of that stuff. So it's they're trying to play in this sphere, but overall, if you were to give them a grade, how would you grade them? And what do you think, if they need improvement, what needs to improve?
Well, the grade would vary right across the report card in multiple different ways. I think there are opportunities for us to really look at how we fast track things like the FDA has been doing, but really do this at scale across the board, right? One of the things with politics is that there's always this rhetoric around, all right, what's this current administration doing? And look, the reality, however, is forget the administration and sort of, who's running the show. The reality, however, is that government servants are there to try to make a difference. All right. What they need, however, is they need collaborators like us really across the industry to come together with them and help them prioritize the specifics of how we actually put those policies in place, how we make them succeed so that they can then help us be successful, right? And if we look at it from that lens, one of the priorities that has been articulated of late really has been to say, all right, let's reduce some of the complexities. Well, I'm all for that. Let's do it. Right?
Yeah.
There is nothing more complex than what exists in healthcare today. All of the billing codes, the challenges around interoperability. Well, let's reduce that. And just even in the FDA example that you were giving earlier and we're talking about, the opportunity for us to really go after this and say, all right, how do we really reduce some of the complexities and then be proactive in understanding the specifics of how these newer trends are coming to be, right? So when you look at things like artificial intelligence and machine learning, you can't go and be stuck with some of the traditional approaches of having FDA certification around a thing that you do because these models are evolving so quickly.
Fast. That's always what I hear from startups.
Absolutely. So it's important for us to really work together, identify those specific problem points, and then come together with policies that will incentivize and motivate these innovations to be scaled and to be successful at large.
Okay, last thoughts from you. So we're standing here at like the beginning of the new year. It's like it's January in 2019, and I'm asking, what's going to be hot this year? Like in terms of like, what do you think this is going to be the year of? Like, we just recently spoke with Jason Gorevic from Teledoc, and it was like we were talking about Toby Cosgrove, who's now doing consulting for Google Cloud. He said this is the year of telehealth, and so if you were to say this is the year of blank, this is the year of what in healthcare?
This would be the year of technology-enabled services done right.
Wow, that was a mouthful. Technology-enabled services done right. All right, tell me what you mean.
So it's really important when you look at sort of service layers, service delivery models, excuse me. Service delivery models out there where you're saying, all right, look, there are challenges around delivering specific sets of services to patients, to consumers. And when you look at the entire ecosystem of delivery of services, one of the challenges that exist is, how do you get to those end users? The opportunity here is for us to really leverage technology in ways that the financial industry has really capitalized on this. The retail industry has really capitalized on this. And for us in healthcare to take that approach and really take these services layer to the very next level so that we can focus in on the experiential layer. Not just on the plumbing layer, but really on the experiential layer. Mm-hmm. That's the promise that we should be going after.
That's what's happening this year. Right. You heard it here first. Rasu, always such a pleasure to pick your brain about what's happening in this industry. I feel like you're just so insightful in terms of just taking almost like a philosopher's look at what's going on and helping break it down and processing for us. So thank you for that. I really appreciate it.
Thanks so much.
Thank you. Always a pleasure to speak with you. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.